Welcome to the Flare Up Show. I am very excited today. I have Melissa Kramer all the way from Slovenia with us today, and I want her to do most of the talking. So
Mhm.
tell us, Melissa, tell us a bit about yourself, what you're known for. What's your area of expertise?
Sure. Well, thanks for inviting me to be on the show. As you mentioned, I'm in Slovenia, but I'm actually Australian originally, and I'm doing my PhD in health psychology at the University of Reading in the United Kingdom. So I have things split across many different places. And I was first known in Australia for launching the first combined sewing lounge and design space in Melbourne. But since then, I had a lot of experience with chronic health issues myself. And about 7 years ago, I founded Live UTI Free, which is a women's health research organization focused on recurrent and chronic UTI. And since then, my team and I have been conducting our own research, as well as providing recruitment and research support for clinical trials and for other researchers and for clinicians. And that's still what I'm doing today and how I ended up talking with you.
I love it. You mentioned something there that I didn't know was a thing. So, what is a health psychologist?
Well, a health psychologist is a specialty within health, and we have a lot of health psychologists on our team who specialize in chronic pain and chronic health issues. So we do a lot of patient-centered research. Our team has been developing assessment tools to really document the patient experience of recurrent and chronic UTI because it's so important to be able to measure that experience so that we can still find a way forward, even if a test is negative or doesn't show anything useful. And so a lot of what we do is in health psychology and how the patient is impacted by recurrent and chronic UTI.
I love that. I love that it is experiential. Like so much of experiential is not I would say our experience isn't always validated in these medical
Yeah,
offices. I love
exactly.
that. I hate that it takes someone having to get PhDs and this stuff for women,
Yeah.
especially to be listened to. That's
Yeah.
actually why I went into health coaching and I went for schooling was because I wasn't being listened to and I felt like I had to
Hmm.
have something to back me up as to why I could talk about my own
Hmm.
body. That's so good for
Yep.
you. That's so exciting. Do you want to add
Yeah.
anything there?
Well, no, I think it's just, I mean, the PhD helps us to do research, which has
Yeah.
been one of the reasons that that has kind of happened. I didn't really picture that I would do a PhD, but with this work, it came about and I was offered a funded PhD position. And so I went into that space so that I could do more work and have funded research. And a lot of our team are actually doing masters or PhDs in this area. So we have more students placed with us each year. That allows us to do more research. So it's actually been a really helpful mechanism for us to make progress.
Love it. I love it. So let's start just from the basics. What is a UTI and what happens to our body when we have one?
So a UTI is an infection anywhere on the urinary tract, which includes the urethra, the bladder, the ureters, and the kidneys. UTI is most commonly caused by bacteria, but it is possible for fungi, viruses, and parasites to be in the urinary tract. It's much more rare, but it can happen. And we've conducted a lot of patient-centered research around this because people report hundreds of different symptoms that come with UTI, and we really don't hear about many of them in the literature. So I have a list here of the things that we've actually documented as the most common experiences. And we found these out by interviewing hundreds of patients. And we also had a panel of expert clinicians in this space to help also talk about their experiences from the clinician side. And so when it comes to urine-related symptoms, the most common are needing to urinate more frequently or urgently than normal, feeling as though you need to urinate despite having just urinated, urine with an unusual or unpleasant smell, cloudy urine, or debris or particles floating in the urine. But then a lot of people also report pain-specific symptoms. So those are pain or burning when urinating or after urinating, pain or discomfort in your lower back or side, and pain or discomfort radiating down into your legs. But there are so many other things that people have told us about. So there might be cold hands or cold feet or tingling in their extremities. Some people get facial twitches. Other people report like fever or chills or just feeling general malaise or like a feeling that something isn't quite right. So I think whatever your experience of UTI, whatever symptoms you've had, there will be someone out there who can sympathize with you. And it's really important to know that you're not alone in this experience.
Hmm. No. How does it affect like your range of motion and that, like with the tingling in the fingers? Like what can you share a little bit of the science as to why that might happen?
The
Just
science
curious.
behind it is usually because the way the bladder is innervated, the nerves run through the bladder and down into the legs. So that's the explanation for why people might experience the tingling in the feet or the coldness and the pain into their legs. But
Mhm.
not a lot of research has been done into this. So a lot of it's based on patient reported symptoms and theory. But it's for the same reason that nerve blockers in certain places, maybe in the leg, might stop bladder symptoms from being felt. And so
Yeah.
it's kind of an interesting area of research that might benefit patients in the long run with symptom relief, but we haven't really seen a lot of work in that space.
No. And again, I'm getting off topic, so I apologize, Melissa, but
No,
even
it's
just
fine.
even with that holistic approach, because there's a lot of science in very specific areas, but then that communication between other areas sometimes. So
Hmm.
we kind of think that these are all isolated symptoms when
Yeah.
it could be a larger issue that's affecting multiple pieces in our body, but we assume that just because the issue's
Hmm.
here, I shouldn't be feeling it up here, but that's not always the case, right?
Yeah, it's so true. And there has been more research recently to show that the vaginal microbiome and the urinary microbiome are interconnected. And there's probably a connection between the gut and the vaginal microbiomes. And if we can understand what's going on in those spaces and how they affect each other, we might be able to provide different treatment approaches that don't destroy the microbiome completely, which is what a lot of the current treatment approaches do.
Yes, yes. Well, and then the microbiome, there's lots of research now going into both serotonin and brain function related. So
Hmm.
it'll be really interesting to see how that all plays out
Yeah,
through research. It's so interesting. Thank you for sharing that.
definitely.
So talk about recurrent UTIs and why is this such a significant issue for women?
So recurrence is usually defined as 2 or more episodes of UTI in 6 months or 3 or more in 12 months. But then we have terms like chronic UTI, which usually describes a persistent infection that doesn't subside even with treatment. When you have a chronic UTI, it's probably that there are organisms embedded within the bladder wall or attached to the bladder wall as a biofilm. And if that is the case, it's very hard to treat it with antibiotics. Your body's own immune system often can't eradicate the infection. So it can result in continuous symptoms for people that just never subside. So we hear from a lot of people who have symptoms 24 hours a day and have had for years, and they're really trying to get to the bottom of that. But a persistent infection like that could also cause episodic symptoms. So sometimes you feel okay and sometimes you don't. But it is possible that it's the same infection causing the symptoms every time, and it's just not being treated properly. And so that's an area of research that a lot of people are looking at now. And we're also contributing to that. I'm trying to do more research into the urinary microbiome, which was only discovered in 2014. And so we need to understand a lot about that in order to know what we should be doing about the problem.
Hmm. Yes. And when it comes to recurrent UTIs, you and I talked a little bit about this just before we started recording because I've had experience and I'm sure
Hmm.
you have as well. Personally, I find that we get into some of these fields and interest because it affects us directly.
Yeah.
Um, but the recurrent UTI or even the persistent, one of the issues for women is that there isn't a lot of options for treatment, or
Hmm.
if it doesn't meet sort of the check all the boxes, doctors just go, oh, well, like, why is that?
I mean, it's true. I would point to the gender bias in health research and in health in general. It's one of the reasons that everything in this space is just so far behind. And like we're talking about misconceptions and why women are just treated in that way. If they have symptoms, they have symptoms. A test doesn't say that they don't have symptoms, it just says they don't know. It may or may not know what is causing those symptoms. But one of the big misconceptions in this space is that UTI testing is accurate. And it isn't. So the main two types of testing that you can get is a dipstick, which is just a strip they dip in your urine, or a urine culture where it's sent to a lab and it's cultured. But urine culture was developed decades ago and it has not been updated and it was never designed for this purpose. And it has been shown in many studies to be up to 50% inaccurate. So it could miss 50% of infections. And dipsticks are even more inaccurate than that. And there's a lot of reasons why those tests are not fit for purpose, but they are the gold standard in the guidelines. This is what clinicians can offer because it's in the guidelines. But it means that a patient can go to a doctor with very obvious symptoms of a UTI, get a negative test result, and then be told there's nothing wrong with them, even though they still have the symptoms. And the test itself could be the problem. So we have a lot of people in our community that have this experience. That's how they enter this community. They have what they think is a UTI. They go to the doctor, test result is negative. They might not be given treatment at all, or they might be given a misdiagnosis. And then they're left kind of to their own devices to try to navigate the system to try to find better options. Patients often do find other types of testing that help them with information that can then point them towards treatment. Sometimes they're just treated empirically if they have a clinician who really believes they have a UTI, even though the test was negative, and they might recover. But we have this huge problem of testing that doesn't work, and then women that are being gaslighted because of it and told that they're probably just anxious or it's all in their head. And we've heard some very ridiculous responses for a woman that goes to a doctor with symptoms, gets a negative test, and is told to take up yoga or to try drinking some wine and relaxing because they're probably just anxious. And this has not changed over 7 years. We hear this on a daily basis.
Yeah. Yes, that's one of the reasons my show exists, because I had
Mm-hmm.
a ruptured ovary and was told to do Zumba so I could be small enough for them to
I
operate
did
on
read
it.
that in your
Yeah.
story, and it just reminds me of all the stories that we hear every week. And some of them just sound like they must be a joke, because how could this possibly be what would happen to a patient with very serious symptoms?
Yes. Well, and I would imagine like any other infection, like if it goes on long enough or it gets in the bloodstream or other things, like
Hmm.
there is a real risk to the health of the person that's experiencing this. And discomfort is enough. Like it is not a good life to live in discomfort every single day and then also be told it could be in your head. It's awful. It's like
Yeah,
psychological warfare. But then
yeah.
the physical health, like that can be at risk too. Like sepsis and other things could be an issue, couldn't they?
Definitely. So you touched on the quality of life impact, which is a huge part of our work. And we've seen that like chronic and recurrent UTI can leave people feeling anxious or depressed or hopeless about the future, and have social isolation because they just can't follow through with plans, or they don't want to make plans because they have no control over their symptoms. And then the impact on quality of life extends across their work. So they don't have the ability to work, they don't have the ability to complete normal daily activities or to even concentrate. So that's a huge part of this. And to tell someone that they're probably just anxious, especially when we know that these conditions cause anxiety, people seem to be looking at it the wrong way around. I do not have UTI symptoms because I'm anxious. I'm anxious because I can't go out in public without the fear of having UTI symptoms, not being able to find a bathroom, not being able to walk because I'm in so much pain. And that's a huge problem in this space too, just having it taken seriously. But then you mentioned sepsis, which is another reason it should be taken seriously. So UTI is the most common adult bacterial infection, and it often can lead to sepsis because of antimicrobial resistance. And antimicrobial resistance is a big problem now. And we're looking at how UTI fits within that and hoping that we can get more funding in that space because of the seriousness of this illness.
Hmm. It is. I was gonna say, like, we know this, like, if people have had cancer or organ failure, we know that it affects the brain, and we don't
Mm-hmm.
assume that they're confused or anxious, and that's what's causing their kidney failure. We know
Right.
it's the other way around. It's
Yeah.
interesting that this is like what, and again, it's gynecological, right? It's that gynae
Mm-hmm.
bias. I would assume definitely.
It
That could.
is. Yes,
Yeah.
definitely. Yes.
Yes, and I love men very much. I have one. I love him to pieces. But if something was wrong with his penis, it would be an issue, and it would be like right to the
Yeah.
bottom very quickly, right?
You would
I
also not have the things that women are told. Sometimes they're just told to stop having sex, never have sex again if it's what gives you UTIs. A man would never be told that. There's just a bias in everything that happens to women in this space.
Yes, when I was telling you before, like just this spring, there was like a recurrence. So it was a long thing and they kept doing tests, and now I'm finally going to a specialist, a gynae
Hmm.
bladder specialist. But because they put me through all this STD testing, like
Hmm.
you look at your partner and you're like, are you not telling? Like it just like
Yeah,
it's so
yeah.
unhealthy, right? Like
Yeah, we hear that a lot too. There's a like a misconception that somehow UTIs are caused by hygiene issues, or I mean, it's true, they can be transmitted during sex. Organisms that cause UTI, sex is like full of organisms There's no way that sex is sterile. So of course you could be passing things back and forth, but it doesn't necessarily mean that your partner's being unfaithful just because something has changed in one of your microbiomes and now you're getting UTIs after sex. So it's also important to talk about that. It might be getting transferred between partners. It doesn't mean someone did something wrong.
Yes, correct, correct. And it is an issue with our body. It's not that we wear thongs, it's not that we're putting the wrong
Yeah.
lotion on, or we're, yeah, it's just insanity to me that
Yeah.
we're told to feel bad about our body having something
Yeah,
that's
and to change our habits first, it's definitely our fault. And then after that, come back and we might talk about it. But those talks never lead anywhere either. So patients are constantly being told to modify their behavior and that they're not able to properly articulate their own experience. They must be wrong about their symptoms because this test says they're wrong. But the test is not about their symptoms, it's about whether it can detect these handful of bacteria. And
yeah.
that's the end of that test.
Yes, or it's more self-doubt and I'm obviously a failure. Like this is just another
Hmm.
thing I cannot do properly, which is insanity.
Hmm.
What are some of the biggest other, I know we've talked about a few misconceptions, but are there some other misconceptions about UTIs that people should know? And what should a woman know if she's experiencing these symptoms?
Yeah, it's there's a lot in this space. I feel like every day we just come up against a problem. A lot of it is what we talked about with patients not being taken seriously and the fact that there was no way to document the patient experience, no assessment tool, which we are trying to address with our own tools now that other researchers can use. But there's just every step of the journey. So the testing doesn't work. Antibiotic treatments have been kind of reduced in duration. So they used to be 14 days in many places, then they were 10 days, then 5, then 3. So this also seems to be contributing to the problem of recurrence that we have 404 million people a year that have a UTI, and around half of those women will have a recurrence within a year. And with every recurrence, there's more chance of another recurrence. So you kind of get into this cycle quite easily based on testing that doesn't work well and treatment that is probably not sufficient. And so we're just looking at issues at every step of the process. Then we have this huge community of patients who aren't being helped because there is no testing offered to them. The treatments aren't long enough. They're not the right treatments. And so I think the perception that UTIs are easy to treat and that you'll have antibiotics and you'll be fine is the case for a lot of people, but there are so many, and it seems to be increasing the amount of people who it is not fine for, and it is not
Mhm.
easy to treat. And so I think that we have to acknowledge that this is becoming a huge global problem.
You mentioned this a couple minutes ago about bacterial resistance. What is that, and why is that becoming an issue? And that's for all infections, right? Like polysporin is no longer effective, like those
Mhm.
types of things.
Yeah, so antimicrobial resistance is when the organism itself develops a mechanism to resist the effect of the antibiotic. So that can happen in different ways, and bacteria can actually share those characteristics, which means if you have a polymicrobial infection with more than one organism, they could be sharing characteristics between themselves to
Mhm.
help fight a particular class of antibiotic. So there are theories about why it might happen. So you might not have enough of the antibiotic, the dose might not be high enough, or it might not be long enough, and therefore the bacteria aren't killed quickly enough and they develop this resistance. But it also might be that it's not the right type of antibiotic for that bacteria. And because they can share these characteristics, the more antibiotics you use, the more chance there is that you have organisms in your body that might have developed resistance. But we have antibiotic resistant organisms all around us in nature anyway. So the organism that you get or whatever's causing your symptoms could be already resistant. It might not be because you've taken antibiotics before.
Yeah.
And patients often think about themselves as being resistant to antibiotics. So they might say, I'm resistant to this antibiotic, but it's not them, it's the organisms that are resistant. So there might be ways, there's research being done about ways that we can kind of stop that from happening. So there's different combinations of drugs that reduce the resistance of organisms and possibly different approaches to treatment that kill or eradicate bacteria in different ways so that we're not dealing with that resistance. But it is a big problem and it's becoming more and more frequent because of the increase in antibiotic usage over the years.
Mhm. I spoke once with, I don't remember his name, is in a former episode, but he works at Rutgers University and he talked a lot about, well, he has Crohn's disease and he talks a lot about, like, even if the medical world looked at immunity rather than being free from, instead as community, like learning to live with these natural
Hmm.
organisms. And like that is really the goal of Like if that was more the goal of medical rather than trying to eradicate everything, and more
Yeah.
like how do we live naturally with these things? And I don't mean
Hmm.
not medicine, I don't mean like naturopath. That's not what I mean. Just like that
Yeah.
we sort of develop our body's ability to remember how to work with nature,
Yeah.
right? And work with sort of the way our body's supposed to work rather than trying to make it change all the time, right?
Yeah, and I think that's important. We've seen a lot of different patients in the community, and my own journey as well just involved many lifestyle changes because antibiotics had stopped working for me. So I had to look at this in a different way, and I made a lot of changes. And sometimes it might be supporting the microbiome that helps someone's UTI symptoms subside. We've seen so many different things work for people that that's part of our message too. It's not, there is no single approach that will work for everybody. And it's really important to think about your own individual history and what you can change, whether it makes sense to use a treatment or not. Like there's no way that you can follow what someone else did and know that it will work. But it
Mhm.
makes it really, really complicated for patients to find the right way forward.
Yes. Like how different would my microbiome be from somebody else? Like the chances of that being the same would be very small, I would
Yeah,
imagine.
yeah, exactly. And the work that we're doing with the bladder biome project in the US is showing us that too. There's such a range of microbiomes that people have, and you'll see similar organisms across a lot of people because we know that the female urinary microbiome has typical organisms, and so does the male urinary microbiome, and they're not the same organisms. But between people with and without UTI, you'll see differences in their microbiomes. And it's a really good point. It sort of shows the nuance of what's going on. And these blanket treatments with antibiotics are probably obliterating those microbiomes. And for some people, that might be a good thing. But for others, it might cause a dysbiosis that becomes long term. And then they're really struggling to rebuild a microbiome. We don't even know if that's possible yet.
Yes, so many unanswered things.
Hmm.
It'll be really interesting. It must be really fascinating. It's disheartening a bit, but it's also the
Yeah.
possibilities, opportunities here now are amazing. We've got to a place where technology is allowing, right,
Hmm.
advances in science. I'm going to ask maybe not the most intelligent question, but but everybody talks about cranberry juice, finding cranberry
Hmm.
juice, taking cranberry pills. How did that come about? And is that actually something people should look at for their lifestyle?
I think the answer is really that if it works for you, you should stick with it because there are so many factors with these studies. So there was a diagnose study that came out recently that showed that diagnose wasn't effective, but it didn't look at the organisms that were found in people's urinary tracts, and it didn't kind of
Mm,
categorize patients into different types of experiences. And we hear from a lot of people who find diagnose to be beneficial. And it's the same with cranberry juice. There was a study more recently that showed that it is helpful, but previous studies have shown that it's not really helpful or that it's kind of neutral. And there are a lot of cranberry extract products that are showing promise, but it really depends on the individual. And it's sort of a trial and error process. Even if something works in a study or shows promise, it doesn't mean it will help you. And if it doesn't show promise, it still might help you. So that's why it's so tricky. It becomes a very expensive process when you have a chronic illness and you just keep on trying things. You're left to try supplements and pay for those supplements yourself. And some people have 40 or 50 different supplements they take every day because they've got to a place where they feel like they can manage their symptoms and they don't want to change a single thing in case that whole status quo disappears.
yes. Yes. And that, I mean, I'm someone that has medications and things myself for my chronic conditions, and there's a little bit
Hmm.
of anxiety that goes with that too. Like, what
Hmm.
if one day we have to go back to not having, right? Like, because you
Yeah,
feel dependent on these things sometimes, and that can be nerve-wracking
definitely.
as well. Like, what if I get stuck without? Can you share your personal story? I mean, you can go into as much or little detail as you like, but I would love to know how you personally got into this field of study and why has it become such an important mission for you to advocate?
Yeah, so I started having recurrent UTI. I had one UTI, I had antibiotics, I felt better. I just assumed it would go away. But a few months later, I had another UTI. I thought, wow, that's unlucky. I should just take antibiotics again and then I'll be fine. And I kept doing that. I kept on getting a UTI. And then my UTIs were getting closer and closer together. eventually I was getting like a cycle of UTIs and yeast infections. So the antibiotics would cause a yeast infection. I would use the yeast treatment. I'd eventually get another UTI, then a yeast infection. So I was just going back and forth, and my whole body started to feel like it was deteriorating. I was getting itchy, and I was just feeling tired, and I constantly felt a little bit feverish, like something was wrong all the time. And then I started to have continuous urinary symptoms as well. And so about 4 or 5 years into this, I started to think antibiotics are not helping. They're not stopping the UTIs from happening again, and they're triggering these chronic yeast infections. So I started to look at other things. I started to change my diet. I was already pescatarian, but I went vegan and I cut out sugar. And I really followed a diet that was geared towards candida or anti-candida. And I also found a primary care clinician who had been through her own chronic health experience and started to support me in some of these decisions. So she provided some information that I incorporated with my own research, and I ended up using a lot of natural supplements, so some antimicrobials and then probiotics, and all like a kind of regime that I put together, a regimen. And over about 10 months, I recovered. So I started to feel better fairly early, which helped me continue, but it took about 10 months for me to not have any symptoms anymore and feel confident enough that I could stop doing what I was doing, because I didn't want to take the supplements forever.
Mhm.
And then I had a number of years where I was symptom free, which was amazing. But I took about a year off after that, not off work, but off thinking about UTIs. I just wanted to be well for a while. And then I launched Live UTI Free because I didn't want other people to have to go through that experience without having a community and educational and science-backed resources. And that's what I've been doing ever since.
That's amazing. Thank you for sharing. Before we wrap up, I would just love to know, are there any sort of general lifestyle choices or activities that we can do that are sort of generic enough that can promote good urinary health?
Fluid intake is always the main one that's mentioned, but for a lot of people that experience recurrent to chronic UTI, that is kind of patronizing. So, I mean, if you're new to it, it really does make a difference to drink enough water, but it also depends on the stage of life you're at. So, if you're perimenopausal or menopausal, postmenopausal, hormones can really make a difference. So vaginal estrogen is the thing that has the most evidence behind it, and that we hear from the most people that have helped this issue. And so that is something that people should discuss. Even women earlier than perimenopause might benefit from that, because there's a lot of hormonal imbalances in the community, and that could be causing the UTI, even if they're only in their 20s or younger. And so that is something that is definitely should be taken into account, hormonal imbalance. And then in the 20s is another time when the like prevalence of UTI increases, and that is often around sex. So there are things that people have reported as helping around sex. So using lubricant, even if you don't feel like you need it, always
Mhm.
using condoms, because that can help with the transference of organisms. And then people do have like just routines they do around sex. So peeing after sex can help. Some people like to shower before and after. But something else to think about is that every piece of your body has organisms on it. So if you have dirty hands and you have sex, you could be transferring organisms from anything you've touched through the day. So even something as simple as washing your hands before sex might be beneficial for people. And there are a lot of other things that people do, and we can share resources from our website or point people to articles. We try to provide as much information about different remedies and whether they work, whether they've been researched, so that people can try to make their own informed decisions.
That's great. Thank you. That's all great advice. Thank you. And where can people find you?
So the main thing is our website, liveutifree.com, but we also have a lot of conversations on Instagram, and our YouTube channel is where we share expert interviews with clinicians who are sharing all different types of treatment approaches, and people find that really helpful to try to find a way forward for themselves.
That's amazing. Thank you so much. Are there any last words of wisdom or support or encouragement you would like to leave
I
the audience?
think just know that you're not alone. There are millions of people in the same position, and you're welcome to reach out to us. And there are also other support groups on Facebook. So there's always someone that you can talk to try to find the best way forward for yourself.
Perfect. Yes. And do what works for you.
Exactly.
I love it.